Welcome to episode 206 of the Pharmacist Voice podcast. I'm the host, Kim Newlove. This is part 4 in a 5-part series about poison myths and misconceptions. My guests are Angel Bivens and Dr. Wendy Stephan. They're both educators at poison centers. They've both been on my podcast before. Angel is a pharmacist from Maryland, and Wendy is an epidemiologist from Florida. In this episode, we'll cover 3 topics. They are, number 1, how movies and TV shows affect our perceptions about poisonings. Number 2, what's really going on behind social media trends like the Tide Pod Challenge, NyQuil Chicken, and more. And finally, number 3, which substances youth are abusing most right now. Before we dive in, I want to share just a brief disclaimer. I have shared this with all the other episodes in this series. Listener discretion is advised. Some of the topics we cover in this series include children putting weird things into their mouths and, as you will hear, other parts of their bodies, poisonings, injuries, and even death. These are sensitive topics. If you have small children or impressionable individuals listening with you today, listener discretion is advised. Thank you. Let's dive in. Movies and TV shows affect our perception about poisonings. As we get started, you'll hear me ask a question, then Wendy will get the discussion started. Here we go. In movies and on TV, timelines get distorted. How can that affect poisonings?
Well, my favorite is, when somebody's been poisoned and somebody tosses them the antidote and they just knock it back and then they're better instantly. I understand there's some creative license, but that's generally not how antidotes work. So that would be the one that sort of that jumped out at me. And then another show that I really loved was Royal Pains. I don't know if it's a few years old now, but it was about sort of a concierge doctor to the wealthy. And at one point they're investigating what they think was an intentional poisoning. And they say, we have poison control here. And in the background are ninjas. And I was like, wait a minute, I want to be a ninja. I didn't realize there were poison control ninjas. So that is not a service we provide. They were in the background, investigating, So yeah, that's not what we do.
Another one in Hollywood is, one sip and you go out immediately. So again, dose makes the poison. So I'm not saying that, but immediate, no, sometimes symptoms are delayed. There are some in Hollywood that will go ahead and actually consult with, poison centers or what have you, if they're going to go down that road. Authors will do the same thing. Will go ahead and do their research. There are times that I'm reading a book or watching a TV show or a movie, and I'm like, yeah, no, that's not right.
I actually have a great book, and it's actually 4 authors, and it's about poison specifically, and it's a whole guidebook to getting it right, which I thought was helpful. One scene in a movie that I think actually has done quite a bit of harm is the scene in Pulp Fiction where they depict an opioid overdose, a heroin overdose particularly. And if you recall it, it's, I think Uma Thurman plays the character, and she's thrashing around. She's basically seizing. She has stuff coming out of her mouth. And unfortunately for a lot of people, that is what they expect to see with an opioid overdose. So I actually referenced that scene in my trainings. And I ask people, what does it look like if someone is overdosing in front of you? What do you see? And they very, very frequently talk about that sort of visual. Of course, in a movie, it makes sense. You need something visual because here's the spoiler. Actual opioid overdoses are not very interesting visually. It is a person falling asleep. So it is quite common in media when they have to visually depict an overdose to depict these really unusual reactions. And I saw one estimate, Angel, and maybe this let me know if this comports with your experience. It only about 2% of opioid overdoses involve seizures. And that might even be a high number.
Yeah, it's very low. It's basically like Wendy said, they fall asleep, they stop breathing.
Yeah, doesn't look like much. They get pale. And as a result, if you're expecting all the drama, that's why we see these cases where people die in front of loved ones. They die in the bed next to people. They're in a party and they're dying and everyone's around them. Nobody notices. So one of the outreach efforts that we do here is to really make sure that someone would recognize a potential opioid overdose so that they could get that person help.
Hollywood, it's trying to make poisonings and things like that sexy just to go ahead and make it interesting and sell. But it's not always true to life.
Right. And that can be dangerous because it sets an unrealistic expectation. And if that expectation is not met, sometimes people will assume that everything's okay, won't they?
Right.
That is dangerous. When somebody does get an opioid overdose, or there is a very serious poisoning and they have gone unconscious, I could see somebody more calling 911 than they would the poison center. Would you agree with that?
Yeah, typically. So the way we sort of describe it, if somebody is down, which is kind of the very first thing that we sort of, when somebody is really experiencing an overdose, they're going to be on the ground. First of all, they're down. And then we do recommend like a sternal rub. Like obviously you don't want to call rescue for someone who's just fallen asleep, whatever. So you attempt the sternal rub. If they don't respond to that, if they don't respond to their name, if you don't get a response, then we would say call rescue. If someone needs assistance, if they have naloxone, right? I have my box of naloxone here somewhere. If they have naloxone and they need assistance in administering it, we can do that. Or if you're dealing with a situation where a person has taken too much medication, they're still fine. That's the window of opportunity where we can assist. Okay, my mom just took, my dad's medicine. They combine certain medications. Is my parent at risk? You have time right now to react, get help, apply naloxone, et cetera. But no, you're correct. Once somebody is down, non-responsive, we want, rescue involved.
Yeah. So if they're unconscious, if they're not breathing, if they're seizing, that's definitely the 911 time. We're not going to be much use at that point.
Oh, that's excellent advice. Yeah. Well, thank you for reviewing how Hollywood kind of exaggerates things and what poison centers can do and what 911 is for. These are good things to know about. All right, let's move on to, I think, our last group of myths and misconceptions. It's actually two things here. We're going to talk about social media myths, and we're going to talk about youth drug abuse and what's really going on. They're both kind of connected. So let's start with social media myths. There was a social media myth that I saw about NyQuil chicken. And of course, I emailed both of you and I said, do you guys know about this? And of course, you both replied and said, of course. So let's start with that. That is something that I've seen on, Instagram, among other places. What's going on with NyQuil chicken?
What I think the intention was to abuse the NyQuil by consuming the chicken. But there are a lot of things flawed in this. If it's meant for teens, it takes a lot of effort to do this, right? Number one, you've got to purchase the NyQuil and a lot of NyQuil, okay? Not a cheap endeavor. Number two, you've got to buy the chicken. Again, a teen in a grocery store? I don't think so. Number three, they've got to then go home and prepare the chicken. Okay. Again, parents of teens, how many of your children actually proactively cook for themselves? Okay. So I'm not sure where that one got started. And then, all the stuff is going to cook off. And, oh, by the way, has anybody tasted NyQuil? It tastes terrible. Can you imagine eating chicken marinated in NyQuil? I cannot.
Well, Kim, we had a speaker actually at our national conference this last year from Common Sense Media, and he spoke to us a bit about sort of these trends. And it was so interesting because he said what youth value, like when they're consuming media, is creativity and novelty. And so I think a lot of these trends that the media interprets as being actual exposure risks is really just sort of creative and bonkers ways of getting eyeballs. And yes, can these lead to poisonings? But it's almost more the media attention that generates the harm as opposed to the initial sort of attempts to grab the attention. So we saw that, with the Tide Pod quote unquote challenge, we really think that initiated from sort of a humor skit that then the media picked up on, spread it to the gazillion people, at which point a certain very small percentage of teens actually did the thing, consumed the Tide Pod, got sick. So I tend to sort of not cover these at my poison center. I kind of just discount them. I say, we've seen this. We're not seeing calls. It's not happening. Just so we don't fuel the fire.
And I agree with that. We do the same exact thing. Now, it's not to say that there aren't some challenges out there on social media that teens are in fact doing and are in fact harmful. Back in the day, the cinnamon challenge. Okay, yes, that one was real and people were trying it, and it is dangerous. Okay.
But not just teens, right? Some of our sickest patients were adults who were kind of jumping on the bandwagon, and we're really sick.
Yeah.
I think it was on America's Funniest Home Videos too.
Probably. Because what happens? You go ahead and you try to take that spoonful, and yes, you're going to spew a puff of brown smoke. And yes, funny. Okay. Visual. Maybe. But cinnamon in the lung tissue is not a good thing.
Yeah, the essential oil is extremely irritating to tissue. Yeah. So we've seen these types of trends like eyeballing vodka, aerosolizing alcohol, and it goes to the novelty issue. But the bottom line is, if you want to consume alcohol, there is a really age-old, time-tested, very efficient way, and it is drinking it. Right? So I just don't get douching, we've seen, this is what kids are doing now, and we're like, ow, okay, but also just that's not what these tissues are designed to do, and our gut really is. So I don't get too exercised about those sort of fringy things. And we do see those sort of novelty things zipping around the internet. But yeah, I am more worried about the sort of true, substance use trends. So when we're monitoring drug use nationally, we are looking at Reddit mentions of certain drugs. So that's very valuable from a surveillance perspective, just to see what's out there. And that does give us an idea of what might be available on the street. It's not so much, like a social media trend, but it does tell us what's happening in the community. And those patterns do absolutely impact morbidity and mortality.
And that's something to note. Oftentimes the media will call us. Hey, what about this NyQuil chicken? Have you gotten calls? Well, just because a poison center hasn't gotten calls doesn't mean stuff isn't happening, right? Because calling the poison center is voluntary, even if somebody is in a healthcare facility, right? So usually when people are using something either as a challenge or in order to get high or something like that, they're not going to call us if they're getting the effects that they want. They're going to call us if something different happens. So we're not that bellwether of, is this a problem in the community? Because stuff can be happening in the community. We're just not getting calls because they're not getting unwanted effects. Okay. Not to say don't call us, because again, we can help. So again, if you're a parent of a teen and you're hearing about these challenges, give the Poison Center a call and say, hey, what do you know about this challenge?
That's a great point,
is
Angel.
It harmful?
Yeah. Questions. A lot of people don't realize that we are available for questions. So, certainly the largest portion of our calls are about actual exposures or suspected exposures, but we get lots and lots of questions. And I see that as a prevention function. Yeah. So from a pharmacist perspective, we're there to answer questions from your customers, your patients. Hey, I'm taking this prescription, but now I want to use this cough syrup. Right? This is an amazing opportunity. If they didn't read the 900-page tiny type insert, I can't imagine that would ever happen, that someone wouldn't read that. But if they just didn't happen to, that's a way that they can find out about the specific thing they're about to do. And so we're happy to fill that role. That is pretty standard practice at our poison centers to answer those questions.
One of the other things that kind of floats around, has floated around on social media is, and again, it's a cyclical thing, but if you get sunscreen in the eye, it's going to cause blindness. It waxes and wanes. Sometimes you hear about that, and that is definitely not the case. It's a big time irritant. It's often water resistant, so it's going to be more difficult to rinse it out, but it's not going to cause blindness. So again, just because it's on the internet doesn't mean it's necessarily true. So call us. Let us be the fact checker there. We can help. Kids licking that squirt of hand sanitizer off of their hand is going to cause them to be drunk. No.
Oh, the media love that. Yeah.
Can you become intoxicated with hand sanitizer? Yes, if you intentionally consume a large quantity. 1 squirt, 2 squirts is not considered a large quantity.
Thank you for dispelling some of these myths. So nobody's really eating the NyQuil chicken. It's just in the media. Nobody's really doing the eyeballing of the vodka, maybe 1 or 2 people, but it's more of one of those things like Mark Twain talked about. A lie can go twice around the world while the truth is still putting his pants on. These are things that people just, they're viral. They just go around, but nobody's really doing them. Very few people, if any.
And again, some more than others. So it's always, you never know.
When I see these things on the Instagram or social media, though, I am thinking about you ladies, and I will be emailing you. Like, what's going on with this?
Getting back to the theme of National Poison Prevention Week, we're there for you.
Absolutely.
Amen. 1-800-222-1222. Now, let's finish up by talking about how youth drug abuse has kind of been sensationalized, kind of like all these myths on social media. There's surveys, there's data out there, and a lot of the survey data says that kids are just fine. They're not taking the drugs, and the ones that they are which ones, guys?
Well, these days, really, we've seen a decline in the prescription drug abuse. So that's actually really great news. And so the very low percentages, we know that that prescribing has contracted on that piece. And I think that has most immediately affected youth. So that's been great, right? It's all a question of access, fewer of these in the home, fewer available to kids when they get curious or depressed or et cetera. So that's really good news. We are seeing, of course, increases in cannabis use, and that's across the board, right? In our whole society, everyone now is using that a little bit more. And certainly vaping of nicotine has just exploded. It looks like we're starting to see a bit of a taper there. So that's really good news. But yeah, it's been the novel thing, again, creativity, novelty, visual things that they can put on, on social media. So vaping really took off, but it seems to be tapering. The concern with vaping really has been, of course, the introduction of nicotine. Nicotine is highly addictive. It's addictive very quickly. So, of course, a really great business opportunity for people who sell nicotine, and that's why youth have been targeted. So our concern has been, okay, kids start with nicotine. That is sort of, we consider it a gateway or a first step toward other substances that have other more acute toxicity potential. So those are the two that, really the nicotine and the cannabis that have been exploding, but some of our traditional poisons are still out there and are of great concern, and particularly alcohol. And so while the novel sort of street drugs or the fringy things and fentanyl and these things get attention, in terms of prevalence of use, alcohol and binge use of alcohol is really still the focus. It is not novel. It is not new. They're not eyeballing it again. Exactly. They are drinking it. And I think parents underestimate how dangerous alcohol is, how available it is in the home, and how they're modeling the use of alcohol. I mean, during the pandemic, how many adults increased their use of alcohol, and in the homes where children are seeing that, they see that that's how they're coping with stress. So yeah, I think the picture on alcohol has actually gotten pretty bleak recently.
And I would say that cannabis, alcohol are probably the 2 most prevalent, and nicotine, 3 most prevalent in teens. Parents should be aware, though, that if a child wants something, chances are they will be able to get it. Okay. Recently went to a local presentation by local police, and they said that, by far it's cannabis and alcohol. But if somebody wants something, there is at least one kid at the school that has access to that other stuff. So it's not prevalent, but if somebody is seeking it, they will find it.
And I was recently involved. We did a needs assessment for a local community on substance use. And we asked our focus groups, the youth focus groups, why do kids start using drugs? And we asked parents, why do kids start using drugs? The answers were miles apart. So adult perceptions were like, oh, for fun, to fit in, to be cool. Kids didn't even barely mention that. What kids said is they're using it to cope with stress. And so how do we protect children from substance use? We get them adequate mental health support, healthcare, housing, all of these things that put terrible stresses on families. And we have ways of supporting kids. So, for instance, we've heard anecdotally from kids, the reason they're using marijuana is because they have untreated ADHD. Right? They say, I can't study unless I'm high. Okay, well, that sounds a lot like a kid who needs assistance with focus. And if they're bouncing all over the place, they're suffering in school, they don't fit in with other kids, and they are self-medicating. Is it a good way? Is it the best way? Is it a safe way? Probably not. But, I think we need to listen to youth in terms of why they start, why that is appealing to that small subset of kids who are involved in substance use. And that's a respectful way of interacting with youth, treating them that they have agency and that they're making choices that make sense to them at that moment, as opposed to, oh, kids these days, they're so stupid, they're so crazy, which is sometimes what you hear, from adults who are quite a bit distant from kids, especially kids now. They're under so much stress. I mean, the pandemic has been rough on everyone, but on youth, particularly young girls, we've seen tremendous increase of self-harm, depression, rates of anxiety. Our local school district, they had rates of depression approaching 50% in surveys.
Wow.
I mean, off the chart, like explosions. And the question was reasonable. It was like, are you sad most of the time? And they were 50% were saying yes. So we got to do more to protect kids from the conditions that give rise to substance use.
How can the average person, especially a pharmacist, get access to the data that you're kind of referring to? I think there was a survey.
So around the country, the CDC conducts what's known as the Youth Risk Behavior Survey, and it's known as YRBS. So the Youth Risk Behavior Survey Surveillance System is its full name. And so those are conducted either statewide, countywide, or in some cases they can be actually school districts. So, we have a huge school district here in Miami-Dade County. So we have an actual school level or district level survey. There are also surveys that are conducted on this by the state in many cases. So there may be a slightly different survey and then you can compare. But I think it's such a good idea to have a picture of the epidemiology of substance use in your community so that you can be on the lookout, both to prevent, but also to note and to take steps to maybe curb the use in your community if at all possible.
Thanks for sharing that. Angel, anything to add?
I think Monitoring the Future is another survey that some districts around the country will use. Again, so it depends on your local area. So that's another one to check out. And then I think NIDA probably has some information on their website with regard to survey information that may be useful. But drilling down locally, I think is the way to go. Call the local school district. What survey tool do you participate in? So you know which of these surveys to look at, so you know what's happening in your community.
Because there is a risk of harm, and we've seen sometimes, particularly law enforcement, that maybe they don't, they see the worst case scenarios, right? So they see that the worst things that happen, and they go back into the school and they say, "This is what kids are doing now, and everyone's doing it." And when you talk to kids and they're so sensitive to what their peers are doing, it can actually have a paradoxical effect, right? So for kids who want to fit in, and then they're told by this authority figure that everybody's doing it, it can actually have a harmful effect. So we really want people to have a factual perspective and really have a sense that indeed drug use, particularly hard drug use in kids, has been declining over time. And so there is actually good news.
I love good news. That's a good place to stop. The fifth and final part of this series will dive into resources for pharmacists. How did that become part of the poison myths and misconceptions discussion? It's because reliable, evidence-based information is part of the antidote to poison myths and misconceptions. We live in the information age, don't we? We're used to Googling everything, and so are our patients. As pharmacists, we know that Google search results sometimes contain a mixture of myth and fact, right? Myth and fact. There's a fair amount of medical misinformation out there. I'm sure you know that. Therefore, the fifth and final part of this series is about resources. That's all I've got for you today. Thank you for listening to part 4 of my poison myths and misconceptions discussion with poison educators Angel Bivens and Dr. Wendy Stephan. Please visit thepharmacistvoice.com to read the show notes. In the show notes for this episode and all the episodes in this series, you'll find the Poison Helpline phone number, which is 1-800-222-1222, links to resources and websites mentioned, social media links, and much more. Thanks for listening today. Enjoy the series. Wendy, this is the bonus myth. Let's talk about the cost of using the Poison Helpline. What's the cost?
All right, so it's always free. There's been some misinformation out there that we really want to counter. I think it came from TikTok. My daughter, who was a TikTok user, shared this with me. Basically saying that, poison control is now charging, you have to pay. And it really stemmed from a misunderstanding where a caller had been referred out for a complex veterinary consult. They had been calling our services for a dog. And the people on the phones, as you know, are doctors, nurses, and pharmacists, not veterinarians. There are wonderful services out there that do charge up front for veterinary exposure. So we do frequently refer folks out for those services, but it is true you have to pay for those. But you never have to pay for our services, and we don't want people to hesitate to call when they need help.
Awesome. Free. You can't beat that.
Yeah.
Absolutely. And the number one more time?
It's 1-800-222-1222.
Thanks, Wendy.